the impact and the solution. First thing we're going to start off with here is, why should I offer ancillary products? Now, here's the thing. Whenever we were sitting down and kind of planning this webinar, we went through, basically made a list of like a million reasons why people should be offering ancillary products. And really what it is we know that it's extra commission, right? Everyone knows that if you're cross-selling, you're making extra commission, you're building your business, all of that good stuff. There's a lot of reasons why we could go into why you should offer ancillary products, but the one reason that we're going to focus in on today is we're focusing on the fact that there is a need from the client's position. There is a need, and also you're trying to find, whenever you're cross-selling, you're finding those gaps in coverage, you're finding those places that they are left vulnerable, and you're finding solutions for them. You're trying to fill in those gaps, the holes in their coverage, and you're trying to figure out how to patch those. So that's the why today. That's why we're focusing on why you should be selling ancillary products.
Right. These products are more for keeping your clients healthy or helping them when they are not healthy anymore. That's really going to be the main reason we're selling these products. The client retention, the commissions that go along with it are things that are obviously going to help your agency or you as an agent. But the products, these are specifically designed to take care of folks and cover those gaps like Sadie was talking about. So that's kind of why I'm so passionate about ancillary products, is because it's taking care of the people and really getting down to how you can help them specifically with their problems. Most of it will be done, fact finding, just talking to the person. They might have some kind of story or something that really relates back to some ancillary product that could help them from some kind of, sad loss, sad health issue, something like that. So these products are fantastic. There's a ton of different ones that we offer and work through. We'll go through a few of them today, but we can always do the same kind of scenario with the impact, the issue, the impact, the solution. We've gone back and forth with that title a few times, but we can kind of go through those on every single ancillary product out there. I could probably even do it with a Med Sup or Med Advantage, but we can do that with you case by case. We'll keep it short today.
Yes, 100%. So with that why in mind, we're finding those issues and we're patching them with ancillary products. With that in mind, let's go ahead and click this here. Okay, so let's go ahead and define this before we get into it. This is going to be real quick, kind of self-explanatory, but let's go ahead and go through it together anyway. So the issue is that problem. It's the problem that you see. What is the potential risk? Essentially, you're looking with your client, you're in that fact-finding process, you're thinking of ways that you can cross-sell to them in the sense of finding things that they need, right? You're assessing the risk. That's the issue.
The impact is going to be more about how it affects your client.
Yes.
So they laid out, X issue here for you. How does that impact the client's life, and how would then the solution be taking care of that impact that just laid out for you?
Exactly. That impact is, how is it impacting their health? How is it impacting their coverage? How is it impacting their bank accounts? All of that sort of stuff. And then the solution is going to be that ancillary product, that product pairing. So that's kind of the guidelines of what we have for today. We're going to try to keep this short. We're going to go through it, but we do have a few examples for you. And the first one is one that we are very passionate here, particularly Clayton is very passionate about this, and this is cancer. These are cancer products.
So this is one, of course, like Sadie said, I'm very passionate about, and I also see the huge need. It's not typically something that we see offered on every single plan, but everybody could use a cancer plan. I could have used one. I didn't take one when I was 25 because I was 25. So that was my mistake. But this is kind of something now that I understand why people need cancer plans. Kind of looking through these different issues, the impact, the solution is obviously there. But what we really want to get into is how it affects the seniors. As we know, about half of the people out there now get cancer. Is it down to 33%?
It's 1 out of every 3 people. It used to be 1 out of every 2 men. Now I think it's gone to 1 out of every 3 men, 1 out of every 3 women get diagnosed with cancer in their lifetime. So
obviously right there, that lays out the huge need for this product, as 1 in every 3 people you're going to talk to might get cancer in their lifetime at some point. So basically what I want to bring up with this, with cancer is the issue. The issue being with cancer insurance is Medicare is not going to cover a lot of the costs that are associated with a cancer diagnosis.
Yes.
So different things that go into effect for that. How it affected me, and I know I wasn't at Medicare age, but it kind of goes hand in hand with the same stuff,
Sure.
is paying for lodging. You know, you have to go up to, I went to the Mayo Clinic, so I had to pay to go stay at an Airbnb or a hotel for that week that I was there. Got to pay for the food while I'm up there. Got to pay for the time, or pay myself for the time off for work. You know, just getting other people up there with you, because it's obviously something that's going to be a very community or family-based illness here. People are going to want to support you and go with you, and honestly, you need that.
Right.
So without having something to kind of help take care of these needs, then you're left of where we're at here now with the impact. You're looking at many different things, but basically medical bankruptcy is the first one that pops into my mind.
Yes.
It's the #1 cause for medical bankruptcy is a cancer diagnosis.
It is, yeah.
So this is a huge problem where we have stuff that can help them take care of this.
Right.
But we got to be asking the right questions. We got to figure out if they have a history of this, how can it apply to them?
Well, one reason why you look at that medical bankruptcy and you think like, wow, yeah, you know that chemo costs a lot. You know that all the medical stuff. It's not even just medical bills. The whole reason why we push these cancer products is because Medicare isn't going to cover the majority of the costs that are associated with it. So like he said, the gas to get where they need to go. Mayo Clinic, I don't think Mayo Clinic accepts Medicare.
Not sure.
I don't think that Mayo Clinic accepts Medicare, but that's a different thing. He's paying for that Airbnb. His family took time off of work. If he needed someone to take care of his pets or mow his lawn while he was out. If in people in rural areas, you know, the closest hospital's 2 hours away, they're going to have to take time off of work. They're going to have to pay for a hotel, just like you. Wigs, that's one thing.
Ooh.
They can be very, very pricey. Good wigs can be very, very pricey, and someone might not be able to afford that, and that might be part of their dignity. You know what I mean? So they want to buy these wigs. It's things like that. Nausea medicine. So nausea medicine actually is only covered up to, I think, a couple hours after your chemo treatment.
Yeah.
Anybody who's ever been on chemo or has seen a loved one on chemo, which most likely all of us have, know that the nausea lasts much longer than just 2 hours after. This money because it's lump sum from this cancer product can pay for that nausea medicine after that. So there's just a lot, but there is one thing that we always talk about, and I don't have a slide on it, but we do always talk about that JAMA Oncology study from 2016. There's about 1,500 or so participants on there that were on Medicare. And the study shows what people who fall into each of these categories pay in out-of-pocket costs related to their cancer diagnosis. So these are out-of-pocket costs. Those on Medicaid will pay upwards of $2,000. $2,116 was the average. Those on VA were $2,300. Employer insurance was $5,400, and the list goes on and on. Original Medicare, $8,000, MedSup $5,600, MA $5,900. So there is that need. There is that need, and that's the reason why people are going to medical bankruptcy.
So she brings up a really good point. She listed off all the different ways that they're going to pay out-of-pocket costs, because a lot of the health insurance out there will take care of a lot of it. So, you know, your scans, everything like that, there's always going to be out-of-pocket costs like we just went through there. Right. But then there's the stuff that's not the medical related stuff that we talked about. That's really going to be the most impactful part of it, because when you're going through an illness, you expect to pay doctor bills, you expect to pay, you know, your co-pays here and there, go get the blood work done. What you don't expect or ever plan for is all the other stuff.
Yes, exactly. And medical bankruptcy is something that maybe someone physically gets over the cancer, but if they've gone bankrupt because of those cancer costs, that's something that financially they might not ever be able to recover from. So that's a huge impact on that. That medical bankruptcy is a really big one. And then that second one is people will avoid the care that they need. And you especially see this in people that are on Medicare, people that are old, you know, they'll say, oh, I can't pay for that. I don't want to put my kids through that financial burden. I don't want to put myself through that financial burden. I'm just going to avoid the care that I need. And that sounds crazy, but we see that all the time.
And that's what I really think is the most important aspect of a cancer plan, is taking the financial part out of the decision for cancer treatment.
Yeah.
You don't want that to be your deciding factor of, can I afford this versus the care I need? Because sometimes it is as serious as life or death, or it's just going to be a bad quality of life versus being bankrupt or, running out of funds to be able to pay for your everyday needs or kind of continue the lifestyle that you've typically led.
Yeah.
Something I like to bring up is my cancer experience. So I got cancer diagnosis, did everything, got all my bills taken care of through insurance and stuff, expected all that. And then there was a nice little letter I got from Mayo saying I owed $36,000 still. And that was going to be my out-of-pocket cost. Luckily, that got worked out, but that's something there that if I would have known, hey, I'm going to have to pay $36,000 for this, I know my family wouldn't have let this happen, but I'd be like, that's something I can't do.
Right. Yeah, that's something that I would say most people can't do. You know what I mean? Just the average person.
And as a 20-year-old male, I was like, nope, that's not something I can do right now.
Yes, exactly. And people who are on Medicare, they're most likely retired. They're not working anymore. They have their retirement funds, they have their savings, and that's what they have. So it's not like for most people, even after, you know what I mean? Like early 20s for you, and then people who are retired, they're already planning out what they're, you know what I mean? They already have their finances planned out and everything, and they probably didn't budget for a $36,000 out-of-pocket cost because of cancer diagnosis. And that's the thing, is cancer plans can help them.
Yeah.
Getting a cancer plan, that's the solution to this. Having a cancer policy can save them, especially people who you're in that fact-finding process and that they have a history of cancer, or people who are just afraid. They don't have a history, they don't have a family history, but they're just afraid of it, and they know the risks of it. A cancer policy, if they get that cancer diagnosis and they come back to you, you played a part in helping them and saving them financially, which is it's just so huge.
So kind of quickly tying it back to our issue. So the issue, obviously, Medicare is not going to cover all of that.
Mm-hmm.
The impact being all the things that we talked about that could go into the cost or deciding if they get care or not. And we can take that out with this solution of a cancer plan.
Yes.
So going back to our basics here, that's going to be our solution to kind of help out these clients who have this as an issue for them.
Mm-hmm.
Now, as we said, 1 in 3, so it's an issue for a lot of people, but you gotta let them know that you're offering these plans and that this is the kind of risk that go along with that.
Yes. Alrighty, so that is our example of cancer. What we're going to do is we're going to have a couple more, we're just going to walk you through this, a couple more. The next one we're going over is hospital indemnity plans. So hospital indemnity plans, we know that Medicare Advantage plans are not going to cover, they're going to leave those clients with a lot of out-of-pocket costs, honestly. They're going to have those co-pays, and hospital indemnity plans are there to cover the hospital co-pays, observation care, which is something that isn't covered by those Medicare Advantage plans, certain medications, and also one of the top ways to hit the max out-of-pocket on Medicare Advantage plans is hospital stays. The first one is chemo, I believe it is, chemo cancer, and then the second one is just hospital stays in general. And if they are if they're on a Medicare Advantage plan, they're a senior, which means they're probably going to be visiting the hospital more often than someone who is younger, so you have to keep that in mind. Hospital indemnity will cover a lot of that. So let's talk about the issue here. The issue is that more and more people are going to be experiencing these hospital copays.
Right.
Why do we say that? That's because we are seeing a huge rise in enrollment into Medicare Advantage plans. Not even just during AEP, we're seeing a huge rise in initial enrollment.
Yeah.
It used to be that most people enrolled in a Medicare supplement, so that way they could jump. They had the option to kind of go back. But we're seeing that the benefits are becoming a lot more competitive with Medicare supplements, especially with things like national networks and things like that. those Medicare Advantage plans are becoming a lot more shiny now. So people, right initially, they're jumping right on those Medicare Advantage plans, which is all fine and well, but you have to keep in mind that means there's more and more people at risk for those hospital copays.
And see, that's something a lot of people that are coming off of group, they see the kind of like that shiny carrot of, okay, a $0 premium. I've been paying premium with my group insurance for a while. Now I can hop over here to a Medicare Advantage plan and you just tell me that there's a $0 premium. Okay, but what's behind the curtain is those out-of-pocket costs, the co-pays for your hospital stays. So there's a lot of stuff that really goes into it, and that what is kind of the fact finding and going through the coverage with the client. Especially a lot of times now with all the phone sales and the call centers making the calls out, getting people switched to a Medicare Advantage plan, and they might not know it, or they're not really fully understanding the risk that they're putting themselves into.
That's very true.
But there's a $0 premium, so that sounds good, and I get some dental benefits. You know, like there's a lot of things that really draws people to them, and they're not bad plans. It's just you got to know what you're getting yourself into and what the risks are out there.
Yes.
So diving into our scenario here is the issue of more people experiencing those hospital copays with more and more people going to Medicare Advantage.
Yes, very similar to like what we just said with cancer.
Mm-hmm.
People are going to see that, they're going to see the financial burden that it could cause, and there's a big chance that they're just going to delay that treatment. They're going to push it off, or they're going to avoid it just in general, especially like those ambulance rides. We talk about that a lot. We talk about that with the, we were just on some webinars talking about hospital indemnity last week. And we talked about how important and how awesome those ambulance riders are, because there's those jokes out there, but they're very true. I'll call an Uber before I call an ambulance because you just don't know how much money it's going to cost. But it's so true. It's a joke, but like it is so true. People are going to avoid or delay that health care that they need because they just don't want the financial burden of it.
Exactly. So that's something that we got to look into. Is I want people to go to the hospital when they're sick. If they have an issue, go take care of it. All of these ancillary products, like we said, are to take care of the clients. If they're not going to the hospital purely on a financial standpoint because they're worried of the copays, they're worried of this, well, let's see how we can alleviate some of that stress.
Yeah.
Because you not being here is way worse than you having to pay a little bit of premium each month to take care of yourself so you can get the care you need.
Yes.
And so the impact here, like we said, is delaying or avoiding that treatment, avoiding that surgery you might need. I don't want to think of how many times I should have gone to the doctor and didn't because of a $50 copay even.
Yes.
So I understand the client side of that of, well, I don't want to pay for that. I'm good on that $30 a month hospital indemnity plan.
Yes.
But then something bad happens. You got to go to the hospital. Now you're looking at a few $1,000 versus that $30-something a month premium.
Yes. And that's the other thing is, you go to the hospital. Here's the other issue that it can be. The other impact that it can be. They do go to the hospital and then they get those medical bills and they look at them and they say, I can't afford these. It causes that fear of going back to the hospital if they need treatment. It almost is like a cycle. Then they might delay treatment later on because they're looking at these bills and saying, I can't afford this. We did hear recently, we heard a story by someone else, a partner of ours in the industry, and he was talking about how a really good family friend had just recently had to put his mother into the hospital, and it ended up being a little bit more serious than what they thought, and so she ended up having to stay for a little while in that hospital. And this is a family of like firemen, and I think like they owned a hardware store or something like that. They were very middle class. They weren't, didn't have anything, they weren't just drowning in the dough, you know what I mean? But they also weren't necessarily not doing well, just normal middle class family, but they just had those normal unexpected hospital copays that they had to pay. And our friend's friend said, it really clicked for him whenever he was going through this with his mom, and they realized that just, something that can happen to anyone is greatly impacted by what we do. Like her insurance was able to pay, her hospital indemnity was able to help pay for that hospital stay. And he was saying, I don't know what we would have done. We would have been financially ruined if it weren't for these products that, you know, we were advised to get, that we didn't quite, you know if there was the risk. Like, it was literally life-saving. It was life-changing for not just the woman in the hospital and her husband, but also for Brian, you're distracting me, but also for her children, who also kind of had to help in financially. So there are real life stories out there that we've heard about how big of an impact this can make. Just those normal, sometimes unaffordable copays can really make a huge difference in someone financially. So
right, and I think that's where a lot of our passion comes from. This is, we've seen those scenarios play out. I personally have had them, family members have had these same issues with their health issues, causing them these pains and struggles. And then now being in the insurance world, knowing that there's a solution for all this stuff. Like, let's offer it. Let's talk to our clients. I say agents because that's what I do, but I talk to you guys about this because I want you to offer it to your clients. And I really believe in all of these products that we're talking about here today. And ancillary products aren't designed just to be a money maker. They're to take care of people and help them out with these exact situations.
Yes, exactly. And that financial compensation is also great as well. But we're not focusing on that part today. Alrighty, so that hospital indemnity, especially after last week, we are really driving home hospital indemnity. We're really on fire for that for Q1. So we'll shut our yaps about hospital indemnity and we'll move on to our last example, which we'll go ahead and fly right through on here.
I'm going to talk to you about hospital indemnity later.
Yes, yes, exactly. So dental, vision, and hearing. This one's pretty self-explanatory for the most part. That's one reason why we really love, we suggest to people who are new to cross-selling, we say, go ahead and start out with DVH because it's one of the easiest to understand. So it's obviously one of the easiest to sell. But let's go ahead and dive to it anyway. The issue, Medicare does not cover dental, vision, or most hearing costs. The reason why we put most hearing costs on that is because we do know that I think next year sometime Medicare is going to start, I believe, is going to start offering some sort of hearing benefits. But like everything else, Medicare only covers what they deem medically necessary. So don't expect those hearing costs to be anything crazy, anything life-changing. It's just going to be what's medically necessary. So there's still very much going to be a need for DVH plans.
Yeah, and so obviously then the issue comes down, or the impact comes down to the dental health just affecting your overall health in general. This is one that, shame on me, but I don't remember in the last 5 years going to the dentist. So I'm sorry, Sadie, for my bad breath. However, this is something where I know it's available to me. I just haven't gotten over that bridge myself of kicking myself and saying, hey, I got to do this. But my wife with the daughter here now has been like, you need to start taking better care of yourself. So guess what I got this year? A dental plan.
Yes.
Because it's so tied to my overall health. I would like to keep my smile, and that's just something that everybody wants to have, is teeth.
Yes.
You don't want them to fall out, that you don't want them to be cracked or anything bad. You want to take care of that. So let's see, how we can start offering more dental products to our clients here.
Yes, so that impact, not only is it cosmetically impactful, obviously, to take care of your teeth, but it also, dental health completely affects your overall health. I actually was doing some research on this just because I wanted to look up maybe some stats and stuff like that. But one thing that poor dental hygiene can lead to an increase in strokes. It can lead to infections. And one thing about that is your teeth are very close to your brain, so it spreads very easily to your brain. It can impact your heart health. Actually, this is something that I kind of have a testimony on. My grandmother passed away from heart issues that were caused by dental issues. Now, she took care of her teeth. She unfortunately had some bad dental care done that ended up causing an infection that spread to her heart. That's a whole different thing, but that goes to show that it truly does, especially those infections can spread so fast in that senior demographic the older you get. And so she was a very healthy individual. but infections are infections. And so it really can impact your overall health. Now, I did want to look up, I was like, surely hearing loss and hearing issues can impact overall health too. I really had a feeling that maybe it might. So I did some research on my own, and I did find in a study that tracked 639 adults for nearly 12 years. These are people, John Hopkins experts. He's an MD with a PhD, all that good stuff. Him and his colleagues found that this is crazy, mild hearing loss doubled the dementia risk, doubled their patients' risk of dementia, and moderate loss tripled risk. And people with severe hearing impairment were 5 times more likely to develop dementia. Now, that's what I found, let's see, on johnhopkins.org. So it's pretty legit. That's just what I found, even just with a quick Google search. So you can see that not only does dental issues, dental health affect your overall health, but hearing health also has great effects on dementia and stuff like that. It's so crazy. And obviously everyone wants to see. We don't have to explain that. So that being said, dental is more than just cosmetic things. It's more than just routine care. It's protecting the overall health.
Right. And with these, like, we have a lot of plans that offer just dental, but there are those DVH plans out there, so they can help spend that money wherever they need. We're not all as blessed as Sadie and have perfect eyes and can see for miles. A lot of us wear glasses. So maybe
vision.
So maybe this is something that they use for just their vision care. And then they do their routine cleanings. And then maybe down the road, it ends up being something with their hearing. So you're taking care of, with a DVH plan, you're taking care of so many issues that could arise in the future. And a lot of these plans, the way they work is after a couple years, the benefits start to grow and they start to get more covered. So they might not need the vision or the hearing stuff as much yet. But down the road, a couple years down, the benefit amount goes up. So you're taking care of them already.
Yes, exactly. And of course, that solution is a DVH policy. So those are the examples that we have for you all today. Let's see. Let's roll right into how do I offer ancillary products. So we see the reason why, we figured out how to identify that issue, the impact that it has on your clients, and what the solution can be. We do have a really good question though before we move on here. Terry, this is an awesome question on cancer. Best carrier, we'll talk about that in just a second. How do I not look like I'm trying to scare someone? And if they say they're smokers, what would be a good reason? Would that be a good reason to have coverage?
In my eyes, that's a great reason to have coverage. People who smoke, they know the risks. You know, it's not a secret anymore. I don't know however long it's been since they took the commercials off the air. People know that is a big risk of smoking cigarettes. However, like you said, you don't want to sell on fear. This is more of something that's saying, hey, you know, this is a risk that's out there for you. Now, I want to make sure that no matter what happens to you, we're taking care of any kind of thing that could come up.
Yes, that is something huge. So we actually do cancer. We do like probably our cancer webinar like twice a year. So we love doing it. And one thing that we do talk about is absolutely do not sell on fear. Do not try to scare them. Because fear is a temporary emotion. It's very impactful. You'll get the sale, but they'll cancel it as soon as that fear is gone. Here's the thing, is educating them on the, did I just spit on you? I'm sorry. Okay. Thought maybe I spit on you. The thing with cancer is if you just educate them, I mean, the facts speak for themselves. You don't have to try to scare them. 1 in 3 people will get cancer. You don't have to scare them. Like I said, just educate them, let them know their risks, and it's up to them whether or not they say yes or no. That's one thing we always hear. Dan Mangus, who's the Vice President of Growth and Development here, he's brilliant. He sold insurance for years and years and years before we were lucky to have him and pull him here at Senior Marketing Specialist, but he always tells this story about, long story short, he didn't offer a cancer policy because, you know, to this one client, because he was just like, she won't need it, whatever, just kind of assumed. She comes back to his office one day and says, Dan, you said that you would always take care of me. And he was like, yes, of course, like I would love to. She goes, do you offer cancer policies? And he was like, oh yeah. Starts to pull out her folders, and she said, no. I was diagnosed with cancer. You said you'd always take care of me. Why didn't you let me know that you offered that? And he said he never, ever, ever let that happen again. So don't let the fear of getting a no, don't let the fear of you scaring them stop you from offering it. Just offer it and let them say yes or no. If they are diagnosed and they chose no, that they don't want it, that's not on you. They chose to say no, but you were there to help take care of them. Educate, don't scare. That's all you got to do.
Something Sadie and I talked about when we were talking about this webinar and building everything here is that exact scenario of just fearing that someone's going to say no, or that they're going to also then be like, oh, you know what, you're just trying to upsell me on everything, I'm out of here.
Right.
They are at an insurance appointment. They know what they're getting into.
Mm-hmm.
If you go to a car dealership and you're there to buy a car and they start suggesting multiple different cars, and some of them are out of your price range, some of them are just trash and you don't want that, you expect them to try to sell you a car.
Right.
You're at an appointment with a client, they expect you to sell them insurance.
Yes.
So just presenting that to them, and if they say, you know what, right now I don't think that's a great fit for me, I can't really afford it, be like, well, we can always circle back to that, but I wanted to make sure you were aware of the possible risks and what wasn't covered with the coverage we're getting you set up with today. And then you can move on.
Yes, and also setting the expectations up at the very beginning of the appointment, letting know that you're going to be building them a benefit package. You're not just there to be their insurance agent, you're there to be an advisor. So let them know up front, if you set those expectations, I'm here to help fill in all the gaps and offer you the benefit package that I believe will work best for you in your scenario, and you really have a good heart behind it. You're not going to come off salesy. They're going to expect that you're not just trying to sell them the highest, fanciest, most expensive kind of car. You're there looking at their scenario and looking at their custom situation, and you're building that benefit package for them. Now, offering ancillary products, this kind of rolls right into that. So all of what we just said kind of plays into that. But the other things we want to hit on here is whenever it comes to cross-selling and ancillary, especially if you're brand new to this, start with one product. If you're brand new to cross-selling right now, you're just selling those core products and you want to get into cross-selling or you want to get into more, pick one product. A lot of times we often suggest DVH. Like we said, it's very easy to understand, so it's very easy to sell. People are used to having it. If an HR person can sell it to them, you can too. I promise you that.
Point.
Yes. So that's one thing. Also, if you're selling a lot of Medicare Advantage plans, if you're one of those offices where you're seeing a lot of people that are going on Medicare for the first time or joining those Medicare Advantage plans, hospital indemnity might be the one that you want to pick up first.
Yeah.
Kind of get comfortable with it. You don't have to get too comfortable with it before you add something else. But then whenever you get kind of your feet settled a little bit with one product, add another, then add another, then add another. Next thing you know, you have a full portfolio to be able to build those custom packages for people.
And that's something that I wanted to highlight too, is if you're worried about, I don't know what pairs best with what, that's what my team does all the time, is help you look at your portfolio and find where we can add some stuff.
Yes.
Now we're not, if you're saying, hey, Clayton, I want to start selling, I want to start cross-selling. But great, what are you working with currently? And then we can dive into what would pair best for you, because then it clicks. It's that much easier. It becomes muscle memory.
Yeah.
And then we start looking at those other product lines. That's something we suggest as a strategy all the time. And as far as our agent resources team goes, we have a lot of different things available, either on our Senior Marketing Specialist University page or just our website in general. A lot of different stuff where you can use to help sell these products and learn about them yourself, so you feel comfortable presenting them to your clients.
Yes. So pick one product and start with it. And then also with each of those products, pick one carrier. You're not going to want to shop carrier. You're going to want to shop benefits. So one thing people are asking, different carrier options that we prefer and stuff. We'll get to that in just one second. But one thing, whenever you're cross-selling, you don't want to go through the process. They're already choosing their MedSup. They're already choosing their Medicare Advantage, their PDP. They have all these options. You want the answer to be yes or no whenever it comes to cross-selling. So you want to be able to ask, do you want to add on this DVH? Do you want to add on this cancer? And they say yes or no. You don't want to be like, okay, now do you want the Aetna one? Do you want the Manhattan Life one? Do you want this? Do you want that? You don't want to get into that. It's yes or no. So choose one carrier for each of those products, one DVH carrier. one hospital indemnity, one cancer. So that way it's a yes or no, and you don't have to shop through all those carriers. There's just no need for that, because a lot of those different ancillary products, that from carrier to carrier, it's not going to be that different.
And people aren't shopping rates with this. When they come to the realization that, yes, I need a cancer plan, it's going to be, can I afford it? Yes or no.
Yeah.
More so than, oh, this one's $2 cheaper. Tell me about this one.
Yes.
The only time that I would suggest having those multiple carriers is more for you.
Yeah.
Kind of holding them back to where you're presenting that to them. You know which one's the best fit for them. As I keep going back to cancer plans, because this is what I'm most passionate about and talk about constantly. But you know, if they had cancer within 5 years, be like, cool, that rules them out of this one and this one. I've got Mutual of Omaha that's got a 10-year look back. You know, that's going to be off the table, but we can go with these options here.
Yeah.
So that's more of like a personal thing, or you're contracted with them for specific underwriting stuff.
Yes.
So if there is something in their underwriting, like they already had a cancer diagnosis, then you have another product that will still fit that same need, but presenting multiple options in that scenario starts to hinder the sale.
Yes. So even on your end, if you're gonna have multiple, have like 2 tops, just because you're not going to want to sell it if you have to also on the back end shop those carriers. So pick one product, pick one carrier, and just offer it.
Yep.
That's the thing with cross-selling, is a lot of people let the fear of, oh, I'm overselling them, I'm doing this, I'm doing that. Like we said, whenever it comes down to it, you would rather be on the side of you asked them and they said no than you didn't ask them and they wanted it or they needed it later. So just get comfortable with it, get your process down, make it easy for them to say yes with those one carriers, and yeah, just sell. So next steps, all of that being said, I'm trying to wrap it up and get you guys out of here. The next steps here, go ahead and you're going to get a call from our team. Talk to us about your situation. Let's build a portfolio. Let's get you contracted with those different cross-selling products. Let's get you contracted with the best things. Set those follow-up appointments. We just had AEP. You just sold Medicare Advantage plans, which means that there's huge opportunity for hospital indemnity plans. You cannot market for OEP, but you can market for hospital indemnity. So use that hospital indemnity sale to also get people in there for OEP as well. And then AMP. We just revamped our AMP program, and we're very excited about it here in our office. Our graphic designer and our marketing team redid our AMP program. It's Agent Marketing Portfolio. It is a service that we provide here for contracted agents for free, which is absolutely insane. You're saving hundreds of dollars. Free marketing materials, brochures, name cards, pill trackers, door hangers, all these different marketing materials. You pick the design, you put your information on them, and you print them out yourselves. But you don't have to pay for a graphic designer. They're already designed here. If you have more questions about that, let us know. Also, I'll put some information on the follow-up email. Yes. Also, alrighty, so now we are in here we're waiting for some questions. Go ahead and ask us some questions. Gosh, I'm having a hard time talking today. Q&A portion. Let's go ahead and get into some questions. I do want to answer a couple. Terry asked about best cancer carrier that we suggest. Is there one that we suggest?
So there's a few. It really depends on, of course, what's available in your state.
Right.
However, we typically lean on 3. It just depends situationally of what's going to work best for you and your situation there. But Aetna's got an amazing cancer product with a 5-year look back.
Yeah.
GTL on that same hospital indemnity contract has a cancer plan with a 5-year look back and a few other nice bells and whistles on there.
We love GTL.
Mutual of Omaha is going to be a 10-year look back. So that's another great one because of the brand name. Everybody knows Mutual of Omaha. They're comfortable with it. So that's not one that people are going to have to worry about, because you'll get some people who are just so loyal to Mutual of Omaha that that's what they want, and then boom, they're on their same med sup contract, they have that cancer plan on there as well.
Yes.
But like I said, it's very situational on what's available in your state. That's what my team does. We can look at specifically in your area what's going to be a great fit for you.
Yes. So Terry, if you want to continue that conversation, talk to our outreach team. You'll probably be getting a call, or our agent resources team, and they'll be able to look at you in your specific area and your portfolio and what's easiest for you and stuff, and be able to kind of customize that a little bit for you. And then Tim also asked, is there a carrier that you prefer with DVH for seniors? This is a really good question. I know that most of the time, again, it's going to be what's offered in your area, what kind of works best for you. If you write a lot of Aetna, maybe Aetna might be best because it's all one contract, so you don't have to recontract. But the main one, the one that is our favorite here in office, it definitely has, I think, as the best benefits in our opinion, is going to be that Manhattan Life. So if it's in your area, most likely if you talk to our outreach team, they're going to say Manhattan Life, but here's our other options as well. So definitely Manhattan Life.
Yeah, that's kind of our Cadillac of dental vision hearing plans. That's going to be the top end. Now there's some options for dental coverage that are more basic coverage and going to cover just dental. As far as DVH goes, yeah, they're going to be one of our top options most of the areas.
Yes.
And a lot of these carriers we're mentioning, like Mutual of Omaha, Aetna, GTL, you might have been contracted with these before and just not have sold them, but we can help you out with that. If you're not having that with us, we can definitely look at how we can move that to us and different ways that we could help you actually sell that product or get more familiar with that product. That's something we love to do here. I know a lot of us are very passionate about helping agents either understand these products to get them out to the clients out there.
Yes. Alrighty, let's look at some of these other daggum Gen Z is running the show today. Hey, we're both millennials here.
Yeah.
Okay, so we still
I'm on the higher end of that.
here. Let's see. And also thank you, Brian, as well. That's really kind of you. Let's see. Alrighty, it doesn't look like we have any other questions. So thank you so much for joining us today. If you want to watch this recording, it will be in the follow-up email. Also, we'll have it on our YouTube page as well. You're going to be getting a follow-up call, like we've been saying. Ask questions if something comes up afterwards, ask someone. You're going to have an expert on the phone, and they'll be able to look at you in your area and what's best for your portfolio and all that sort of jazz. So please be looking out for those calls and that email. But yeah, thank you so much for joining us.
Thank you all.
Awesome. Thanks.